Welcome to assessment number 2, preparing for advanced practice. Today I want to talk about pressure and not the meaning we would normally assign to the word pressure in our work roles like report deadlines and time constraints. I'm here to talk about physical pressure on our patients that's leading to them developing pressure injuries, and I want to do an environmental analysis on the issue. For this assessment, I have selected my own clinical area. Mine is a 30-bedded acute medical ward. We have a nurse-patient ratio of 4:1 for morning and evening shifts, and for night shifts, 3 nurses manage the whole ward. It can slightly vary depending on the acuity. And for the environmental analysis, I am analyzing the development of pressure injuries in inpatients. Right now, we have 4 patients in our hospital with healthcare-acquired pressure injuries. This month alone, there have been 8 patients who have developed a pressure injury while in our care. The framework used for analyzing the issue here is the SWOT analysis, which is the strength, weakness, opportunity, and threats model. This framework facilitates the identification, analysis, and realignment of organizational issues and goals. SWOT analysis assesses internal and external factors as well as current and future potentials. Identifying core strengths, weaknesses, opportunities, and threats lead to fact-based analysis, fresh perspective, and new ideas. This presentation also includes an analysis summary including the legal, social, and ethical aspect of the issue, and concludes with the recommendations for practice change. Starting with the first aspect of SWOT analysis, which is the strengths. Strengths are favorable internal factors. First one is the nurses have adequate knowledge about prevention and treatment of pressure injuries. We have highly experienced and knowledgeable nurses working on our ward. Secondly, there are wound care champions for the ward. Wound care champions are nurses with the most updated knowledge on wound care. They act as resource people for others. They take leadership in wound care educations and audits. Third one, skin assessment is conducted on admission and on every shift thereafter. Skin assessments are recorded on the care path as well. High-risk patients are identified and provided with skin care bundles. Skin care bundles are an initiative in our ward. Skincare bundles are little packs that contain skincare products like moisturizers, barrier creams, heel protectors, and so on. So as soon as a patient is identified as high risk for developing pressure injuries, they are provided with a skincare bundle. The last one is the availability of pressure relieving mattresses and gel cushions. The next aspect in SWOT analysis is the weaknesses. Weaknesses are the internal factors that are adversely affecting the situation. The first and foremost identified issue is the failure to use a validated tool for identifying risk and to prevent pressure injuries. I will talk about this in detail in recommendations. Number 2, nurses fail to do a skin assessment every shift or fail to check skin underneath a medical device. Third one, nurses fail to document on care path every shift or fail to document baseline skin condition on admission. Last, even if a high-risk patient is identified, nurses fail to initiate all the necessary strategies in place in order to prevent any further skin damage. Moving on to opportunities. Opportunities are the external favorable factors. The first one is the company representatives in service on newer and improved products for wound care. We get lots of them. Whenever there is a new product or technology is introduced, the representatives come around and educate the staff. Second one is the annual National Wound Conference. Nurses have the opportunity to go to these conferences. They can utilize their professional development work hours and allowances for this. Third one is the Wound Care Advanced Practice Nurse. The Wound Care Advanced Practice Nurse is not based on our ward, but always available if we need advice. Last one is the threats. The identified threats are the extended hospital stay and complications for the patient, poor patient outcomes, and legal and ethical complications. Moving on to the analysis summary. This is discussed under 3 major headings: legal aspects, social and ethical aspects. Starting with the legal aspect of hospital-acquired pressure injuries. The main legal issue identified here was the failure to use a validated risk assessment tool. As per the National Safety and Quality Health Service Standards 2017, hospitals must ensure that assessment of pressure injuries includes the use of a validated risk assessment tool. The current tool that we use in our hospital is based on nutrition, age and mobility, and offers a suite of preventive measures. However, none are aligned with a particular risk, rather just listed as options available. Another major legal concern is the lack of insurance reimbursement for hospital-acquired pressure injuries. Ours being an acute private facility, lack of insurance reimbursement is a major legal as well as financial concern. In July 2018, the Independent Hospital Pricing Authority, in collaboration with the Australian Commission on Safety and Quality in Healthcare, implemented financial penalties for hospital-acquired complications, which includes pressure injuries. Next is the ethical aspect of hospital-acquired pressure injuries. For clinicians involved in pressure ulcer prevention, ethical issues surrounding accountability may arise from both policy and practice perspectives. And the social aspects. The reputation of the hospital is at stake. Increase in the number of hospital-acquired pressure injury adversely affect the reputation of a hospital. And also, nurses are held accountable for hospital-acquired pressure ulcers that develop and worsen during admission. Based on the SWOT analysis conducted, I am putting forward 2 recommendations for practice change and improvement. Failure to use a validated risk assessment tool being the major issue identified, the first recommendation will be to use a validated risk assessment tool like the Braden scale. Use of Braden scale is supported by a recent literature review by Garuba and Melder in 2017, where they said the Braden scale was found to be the most extensively validated tool with a meta-analysis of studies confirming a good predictive capacity. Second one will be educating the staff about the importance of comprehensive assessment and documentation of skin integrity. The education unit will be engaged in the implementation process to support and educate staff on the change to the Braden scale, including education, learning packages, and to champion the change at a local level. Something I do want to make very clear at this stage is this is not an additional task that is required on top of the current workload, rather a change from the current risk tool to a new screening tool that will offer better guidance for clinicians. Thank you.